Good evening, sir.
Good evening. Yeah.
Okay. Hello, Dr. Avantika. Am I audible?
Yes,
Yes.
Yeah. Okay. So, shall we start?
yes, why not?
Okay. So, hello, good evening, everyone. We are back with our live session at Healer's Corner. And today we have with us our speaker, Dr. Avantika Jatkar. And she is pursuing her BHMS from Antarbharti Homeopathic Medical College, Nagpur. She is a very enthusiastic and eager student. And Dr. Kamlesh Kakde, sir, he is a founder of Us Health Foundation and has been practicing homeopathy in Nagpur since more than 15 years. And he has gained his fame in treating most difficult pathological cases. So today we are going to discuss about joint pains in winter and how we can treat them naturally with homeopathy. So over to you, Dr. Arantika.
Thank you. First of all, thank you, Neha ma'am, Kamlesh sir, and Vinaya ma'am for giving this opportunity to me. Am I aligned properly
Yeah.
Yes, yes.
and audible?
Yeah.
Okay. So my first question is, why does joint pain worsen during winters?
Okay. So first of all, happy winter to everyone. And winter is actually we consider winter as a very healthy season. But winter comes with lot of health problems also, like what Dr. Arantika is asking, that there are a lot of joint complaints which increased, aggravated during winter. And there may be a lot of reason for that. So first reason is that we have this synovial fluid in our joints, right? And due to temperature changes, due to cold weather, this fluid which is present in joint between two bones, it may get thick, and that's why um, the what work it has is of lubrication, right? So there may be some difficulties in doing this lubrication, and that's why we may face uh, joint pains or joint problems. Second, there are some barometric changes also because of drop in temperature meters. And this,
Okay, so we
yes,
can say that the weather changes directly affects it.
yeah, definitely. So these barometric changes actually affect our joints. There is
Okay.
stiffness of muscles and tendons because of low temperature, and this stiffness cause difficulty in movement, and we have very restricted movements in winters, right? These are very lazy days. We don't want to exercise, we don't want to go out of our homes, and we just want to sit and watch TVs series, and so our activities decrease during winter. So this is another reason why we have more joint pains. Also, our thirst decreases during winter because of uh, cold weather, and lot of lo- many of us faces dehydration, and we are not aware of this actually. And this dehydration also causes muscle pain, joint pain. So these are some common factors why we have more joint pains during winter season.
So is it that the person who don't face any kind of pain, he could also face the pain in winters?
Definitely, anyone can face pain or stiffness during winters because of one of these reasons. Because we all has to face, we are prone to this type of weather, cold weather condition. So any one of us may have this
Okay.
complaints.
And what lifestyle can reduce us help this?
Yeah, definitely. As I said, that we have very restricted or limited movements during winter, right? We
Yes.
we had, you probably uh, aware of that, we have done Insta Live on SAD, right? Seasonal affective disorders. So what is
Mhm.
seasonal affective disorders is because of low temperature, our moods becomes very sad and we don't want to go outside, and our actions, our movements become restrictive. And all these changes causes stiffness of joint pain, muscle pain. So what we should do, we should avoid this. We we should be more active, we should go out of home and we should walk, we should do some regular exercises, yoga, so that our basically our joints and muscles should be active all the time, and this will reduce the pains and stiffness. We should drink a lot of water during winter especially, and especially warm water we should drink. So warm water will produce some heat in our body, and that's how our stiffness of joint may be relieved. We should try to cover our joints. We should wear sweatshirt or sweaters during winter so that our joints and muscles should get warm. So these are some lifestyle changes. We should eat some uh, food which is hot in nature, not in hot in temperature, but hot in nature, like sesame, like jaggery. So we can try this. We can try soups. So these are some lifestyle modifications we can do during uh, winters to avoid joint pain, muscle pains.
So basically, we can call this home remedies also,
Yeah,
like
these are home
hot
remedies
food.
to these are some tips you can say to avoid in a way, or if you have some joint pain or muscle pain, you can reduce these joint pains. If you can use turmeric and jaggery, and if you can if you have these turmeric and jaggery together in equal proportions, these are very beneficial to reduce inflammation, to produce heat in joints. So in this way, these are some of the home remedies you can try so that your joint pain, muscle pain can be reduced.
So this is to avoid the pain, like for the persons who don't want to reach to the doctors, to
Yeah, true,
keep them away.
true, true. At least
And
we can try this. We can try this.
yes,
Uh, I'm not saying that this will cure all your sufferings, but we can at least try this at home. This will definitely reduce intensity of your pain and suffering. Probably it may not relieve you completely, but it will help you.
then how does homeopathy help managing this? And are there some remedies you could suggest us?
Yeah. So basically, homeopathic holistic science, right? And how homeopathy works, homeopathy in turn increases your immune system, and this increased immune system help reduce your pain and suffering, any disease you may have. But this is how homeopathy works. So it is very good idea to take homeopathic remedies because we don't have painkillers as such. We don't have steroids in homeopathy. But what we have such medicines, holistic medicines, when we select properly on the basis of symptoms, it increases your immune system, if your immunity. And this increased immunity decrease, relieve your inflammation, stiffness, or pain in joints or muscles. So homeopathy definitely helps in cases like arthritis or joint pain because of winter also. Talking about medicines, what medicines we can use. So how homeopathy works? homeopathy is holistic science and it depends upon symptom similarity. So you have to match symptoms of patient with the symptoms of medicine. So we don't have specifics in homeopathy. I don't believe in specific remedy for specific disease, but we have specific remedy for specific patient. So we need to understand that patient in detail. So if you will ask me what are the good remedies for arthritis in winter or joint pain stiffness in winter, I may not be able to tell this because there are no such specifics. We need to understand that patient. We need to take note of each and every symptom of that patient in details, and then we need to match these symptoms with the symptoms of medicine, and then only we can help patient in a better way. We don't act like modern science that there is this pain is there, so this medicine is there. So we don't have specifics in homeopathy, but we have very uh, good medicine for that particular constitution, that particular patient. So we need to understand that patient. Hmm?
But like, can you give some example of any patient suffering with this, and what kind of remedy you recommended or medicine you prescribed to him or her?
Yes, yes. So there are a lot of patients coming these days with these stiffness and joint pains, and sometimes with fever also. And if there is intermittent type of fever with chill and too much stiffness, then eupatorium, this medicine helps a lot. But don't try to prescribe eupatorium to each and every patient with stiffness in winter. Oh, we need to, as I said, we need to understand that patient. Why I prescribed eupatorium? Because I evaluated that patient in depth and we understood that patient. I matched that patient's symptoms with the symptoms of eupatorium. That's why I prescribed eupatorium. This is one of the example, but if you prescribe medicine on symptom matching, then you will have great effects. You will have great results.
And when should anybody consider to whether to consult a doctor currently or not?
Yes,
Because joint pain is like somebody like they ignore it mostly. And when it is in severe conditions, then they are like, oh my God, I'm facing this in lot pain. So what is the right
true,
stage that a person should consult a doctor?
true. Generally, what we do, if we have joint pain or any type of pain, then we take painkiller, over the
Yes.
counter painkiller, and we try to relieve that pain temporarily, and we resume our work, and we are happy with that. But this can be very dangerous because if we have pain, for example, if I have pain in my knees, so why do I have pain in my knees? Because there is something there is some problem in my knee, and this pain is cry of my body to show that there is something uh, bad happening in my knee, right? So
Yes.
if I will not treat that problem, but I will just shut my mouth that don't cry, even if you have a problem. This is not a good idea. We need to address that problem. We need to correct that problem. And then that cry will automatically go. Are you getting this?
Yes.
So we should not take over the counter painkiller or some temporary remedies to just relieve the pain. But we need to address the cause of that suffering. We need to address what is disturbed in that part. And when we correct this disturbance, then pain will automatically go. Pain is good actually. It is showing that there is some problem and you should not use your joint. You should take rest. You should not exert this joint. So pain is good for you. So don't think that pain is your enemy. Pain is good. And when to consult doctor? When this pain is affecting your routine. This pain is persistent for long, is not relieving by its own within 1 or 1.5 day. If it is not relieved, then immediately consult your doctor. If it is affecting your uh, walking, your routine, your work, then immediately consult your doctor. This is the point when you should consult doctor and seek proper remedy, not just painkiller, but proper treatment to relieve that disturbance. This is the idea.
But in our daily life, if we look around, then there are few peoples like the families where there are no people who are like medical, who have medical, proper medical knowledge. So sometimes it happens that even after long time period of the pain, they are like कुछ नहीं होता यार छोड़ना, देख लेंगे, खा रही हूँ मैं दवाई घर पे ही, हो जाएगा ठीक. So people have such a mindset. They don't get it that we should consult a doctor or there might be some risk behind this. So what about that mentality?
True, you are right. And unfortunately, this is the fact. But tell me one thing. If I have to construct a home, so is it
Hmm.
necessary that I should have all the knowledge to construct a home?
Hmm.
I can assign any architect or any builder who will do this job for me, right?
Yes.
So then why we think that we should have all the knowledge to treat ourselves? We should have all the medical knowledge. Huh? If we
Hmm.
have some health issues, then there are a lot of experts out there, na? Health experts, doctors. We should consult them.
Yes, they are, but the mentality is कि नहीं जाना, हो जाता है घर पे ही ठीक.
True. But I think,
Even after it's not getting better, they try it at home.
yeah, true. But Arantika, people like you and me, when we are talking on Insta Live, we are doing this Insta Live, I think this is the good medium for social awareness, right? What we are doing is we are trying to aware people that what we should do and what we should not do. So this is very good question you come across that uh, I'm very glad you asked this question because lot of people will get benefited after this suggestion. You know, so we are the people who should educate the common people. We should aware people that this is not right. How you should think, how you should look at the problem is this and not the other way. So I'm very happy you said at the beginning of um, this Insta live that you're thankful to us, but no, we are thankful to you. That you come here, you accepted our invitation, and you came and uh,
No,
spending your
sir,
time.
it's my and pleasure that you gave me the opportunity. If you would have not invited, I would not have been here.
So it is the other way too. It is right the
Yeah.
other way too. Huh? So I'm very happy uh, for the people, new people like you, who are very enthusiastic about homeopathy, about health, about spreading awareness, and about doing such events which can make people aware and make people to guide people. So this is very good thing. I'm very happy. I'm very glad to see people like you who are very enthusiastic for doing this.
Thank you. Okay, so getting back to our topic. So, what
Yeah,
are the risk factors after avoiding this pain, like for long duration?
yeah. So sometimes we may feel that. nowadays we are seeing a lot of chikungunya patients. So before 3 4 years, chikungunya was like uh, acute infection within 2 3 days, pain subsided. But now people are having chikungunya symptoms or post chikungunya symptoms even after 3 4 months. So if you neglect this stiffness, this pain during winters or cold weather, then this may take a form of chronic disease. This may damage your joint. This may damage your muscles or tendons. So we have got this body for once, no? So we need
Mhm.
to take care of this body because we have to, in a way, you can change your bike, right? After 4 5 6 7 years, you can change your car, you can change your home, but you cannot change your body. So
Right.
you need to take care of your body. And if we
So,
neglect our body or symptoms of our body, then it will be very difficult after a few years. So there may be lot of side effects or lot of what we can say uh, bad outcomes if we neglect small symptoms like stiffness and joint pain or muscle pain. So we must be very careful. We must listen to our body, what to do, what not to do. This is very important.
we have a comment below. Person suffering with cough and cold take medicine without consulting a doctor. Also, I have a question that can over-the-counter painkillers or topical ointments provide long-term relief? And if not, then how does this like affect our body in negative way?
Yeah. As I said, that if you have, say, some problem with your joint, if you have osteophytes in your joint, and these osteophytes are rubbing each other on joint, and that's why you have pain, right? If you apply topical some ointment or if you are taking some painkiller, that you will not feel pain, but these osteophytes will be there. This will go on rubbing on each other. This will harm your joints, and when effects of painkiller will subside, you will have more severe problem, more severe pain, because by that time these osteophytes have eroded, destroyed your this joint. So that's why applying local ointment or taking painkiller is not a good idea. But what we should do, we should try to recover this problem and not the pain. Pain is good for you. Pain is telling that there is something wrong with your joint. So we need to correct that disturbance, that problem, and pain will automatically go away. So taking topical medicine, local medicine is uh, it may relieve your pain for some time, but it is dangerous in long term. And we have to carry our body for long term. No? It is not a question of 1 to 3 days, but we have to be in this body for say 80 years. So we should take care of this body. We should not play with our body.
But like there are few people who also take medicines it at home itself without consulting any doctor. So yeah, though these medicines are correct ones, like it are particularly for joint pains or any kind of pain, but is it good for our health that they are consulting themselves?
Okay, let me go back to my example. If I tried to construct my own home without consulting anyone, because I know how to put
Mm.
bricks on each other, on each one another, right? And if I construct home, what do you think? Will that be a good home?
No.
No, definitely not, because I don't have. Um, I'm not skillful for that. I'm not skilled in constructing, right? So people should understand this, that they are not skilled in treating their body, because there is concept of individualization in homeopathy, right? So what we
Yes.
believe that we all are different, and this difference is not just emotional distance or difference or mental difference, but physically also we all are different. We Our middle ear is of S shaped. You probably know this, no? But
Hmm.
each and every person's this S shape is different. So each of us is different. Each of us is individual. So we need expert to understand this difference. And we cannot generalize that if I have fever and I should take painkiller, paracetamol. There are
The
now
major
some research
difference.
paper. Yeah, there are research paper that paracetamol is the most danger drug, which is very commonly used. You can get paracetamol in any shop, but this is the most danger drug, having lot of side effects. But we are missing this. We are playing with our body, and we will we may end in lot of trouble. Like, for example, you know what is the main problem in ICU setups, ICU treatment? Main problem is in ICUs antibiotic resistance. That antibiotics are not working in ICUs. So lot of doctors are frustrated when they have some patient and they prescribe antibiotics. It is life-threatening situation, and higher antibiotics even they don't work. Why? Because we have used those antibiotics for our cold and cough.
Hmm.
And when actually we have emergency, then when we use same antibiotic, that those will not work. This is the major problem of ICU management. So these are our life, what we can say, uh, lifelines, specific antibiotics,
So,
higher antibiotics. So we must use this very carefully. We are not aware of these facts. Common public is not aware of these facts. So we should not take medicines over the counter, or uh, if I feel that I should take this medicine, we should not do this. We should consult a proper doctor, and then only we should take medicines.
so basically, we can call paracetamol as the sugar of our daily life,
Yes,
just like sugar
yeah,
is a slow poison.
yeah. This sugar is killing us, but
Yeah, definitely. So similarly, paracetamol is the poison in medical life. Like
true,
person take without consulting, and it's like a daily routine for a person to take paracetamol.
true,
Whether it's a bit of temperature in their body, let's have paracetamol.
true, true. There are
There is a
some
box separately
guidelines to
maintained.
use. Yeah, there are some guidelines to use each medicine, right? So
Yes,
if we have 102 temperature, then only we should take paracetamol. But I see lot of people who has just 99 degree Fahrenheit temperature, they take paracetamol suddenly.
exactly.
And this is not useful. This is harmful actually. But people are not aware of this. That's why we need to consult expert. We should not do like this. Otherwise, I will
Okay.
end up in building very bad home for me.
So then basically, what are the some tips you would give us to stay motivated and exercise during winters to be devoid of this pain?
Yeah, yes, this is the answer. To be devoid of the pain is the motivation. This must be the motivation. If you want pain, then don't do anything. If you don't want any pain, then we must do. This must be the motivation to
Uh,
stay away from the disease.
can you once recall again remedies or the factors we should always be aware of to avoid it?
Yes. So we must be very active. We must walk a lot. We must do movement of each and every joint of our body. We must drink warm water. We must be hydrated all the time. We must cover our body, joints, stay warm all the time during winters, and we should eat some hot food and drinks. So these are some tips to avoid or some to in a way uh, to treat our sufferings during winter.
Is there any kind of major factor which we can use? Like, it will definitely help us to avoid it, or all of these are important.
Yeah, these are the very important factors, and it can be easily done. It is very cost effective. All these factors, they don't need lot of money.
Mhm.
Or these are very cost effective, and we can easily do this.
It just needs our time,
Yes,
which is most
more
costly,
than
and
time.
people don't give it.
Yeah, more than time, it just need motivation,
Yeah.
awareness. If we are aware, then we will do this. Otherwise, we won't do.
So now, since you're having such a long period of your professional career here, can you give us one of the example you had faced related to this arthritis or joint pain, and what kind of follow-up you met with this?
There are a lot of arthritis patient I have seen, even in very severe condition. I have seen patients who have severe disc bulge and nerve compression, radiculopathy, and two, three people they supported him to bring to my clinic. And these are very one of the very difficult cases of my practice. But to my surprise, when we carefully take note of each and every symptom of this patient, we study symptoms of this patient, we repertorize, and we find good medicine for this patient. Only this small sugar pills, they help these patients so beautifully that within 15 days, that patient come walking to your clinic without any support. So I have seen these miracles in my practice, and that's why I have such a huge faith in homeopathy, because I am the first one who questioned uh, homeopathy results, but I am seeing results daily in my practice, and this is
So,
so motivating. This is so fascinating. It fascinates me even after 16 years of my practice. Daily homeopathy surprises me with its results. It is such a amazing pathy. But for that, you must put all your heart and blood and efforts in this pathy to study, to understand patient, to analyze patient. You must have this empathy to treat and to cure the patient, and results are amazingly amazing. As you probably may aware that we are now doing research on cervical dystonia, which is considered as uh, incurable disease in modern science. And to my surprise, each and every patient of cervical dystonia is improving like anything.
so we can
So,
say homeopathy is a wonder miracle.
yes, it is wonder miracle. But for that, we need to mm, give our life and soul and blood and sweat, everything to homeopathy. Then only we can produce such amazing results.
For every student and practitioner of BHMS, it's like the day one as a student, shit, majboori se aa gaye. Like no one would say that we are here by choice. Even me as a student in my class, day one was like, ठीक है, नहीं मिला score आ गए. And later on, looking towards the practitioners, teachers, it's like they are so glad that they had pursued this degree and practicing it.
True, true.
Yeah.
So it may not be our first love. It's okay. But
Yes.
unfortunately or fortunately, if we married with homeopathy, then we should try to do our best, right? This is
Yes.
our fate. And homeopathy, if you will understand homeopathy, then you can see the beauty of its results. It has such an amazing results. I I told you no, that I'm still surprised daily with the results, even after 16 years. So it is such an amazing pathy.
Any guidelines you would give to our audience related to homeopathy, like students of our homeopathy,
Yeah,
regarding their
true,
studies or practitioners to how whether they should practice?
true. So my suggestion is to always be student. I'm still a student. I'm still learning. I'm still learning from my masters, from my patients, from my colleagues, from my students, from various books, literature, seminars, webinars, and everything. Each and everything is teaching me. So when we be student for a lifetime, then no one can stop our growth. And if we will become confident or overconfident that yes, I know everything, then from that day your degradation start. So always be student of homeopathy. It is such a noble science. It is such a huge science that you will be surprised daily with its miracle and the new knowledge, wisdom it will give you. But for that, you need to be uh, acceptance mode. You must be open to see what is there out. So this is my suggestion. Be open, see, observe, study, and this will open lot of doors, lot of possibilities for you, even in your life.
You actually gave a really good line, like always be a student. Thank you for this. And once again, thank you for inviting me for this session, and wonderful all the guidelines you went with about joint pain and how to ease it and making us motivate. Thank you so
Thank
much.
you so much, and I'm so glad you are here. And be a good student of homeopathy.
Yes.
You have a lot of possibilities, and best of luck.
Thank you.
Thank you both. It was really a wonderful session. I hope it helps our audience to realize how much adverse effects they can get of self medication and helps them to be motivated during winters to exercise and maintain a good lifestyle. Thank you both.
Okay, bye
Thank you.
bye.
Bye.
Bye bye.